Okay, good night and welcome again. Our platform rules during this session are as follows. The moderator will guide the process of the session. The presenter will deliver information and will be interactive or reserve questions for after. Participants will raise hand to speak and will wait to be acknowledged, and that is the raise hand symbol at the bottom of your toolbar, the bottom of your screen. There will be no speaking over each other, but speaking in turn. And I want to, at this time, just pause to commend the platform for what a wonderful job you've been doing in the past in maintaining order and showing respect on the platform. Just pray that we continue that. So I want to also encourage everybody in our fifth platform rule, focus your question on the testimonies. Participants will focus their questions on questions or testimonies on the subsection being discussed so we can stay focused on what we're presenting tonight. So, as you've been waiting and anticipating, I would like to introduce to the platform the president of Rapha Shalom Restoration Ministries International and the chief operating officer at Le Marie Natural Health Consulting, Dr. Lincoln Carty. Welcome, Dr. Carty.
Toda, thank you very much. Good night, everybody. I'm very happy to be here. Another time to share with you. And without further ado, we would want to jump right into our presentation. So I will just take the opportunity to share my screen very quickly. Okay. Okay, so at Le Marie Natural Health Consulting, we always encourage you to empower your mind, enhance your body, and embrace your life. And I'm hoping that tonight's presentation will help you to do just that. We are going to be focusing on healing massage techniques, but tonight specifically, our focus will be on the effects of massage. That would be the second part of my presentation from last session. And then we will have Mr. Aaron Ferguson doing his demonstration on body rejuvenation techniques. So those would be the two presentations for tonight. And we just want to remind you of a very important text in scripture, Matthew chapter 11 and verse 28, where Yahushua says to us, "Come to me, all you who labor and are burdened, and I shall give you rest." And one of the things that massage does for us is give us that rest that the body needs in so many different ways. And we are going to be looking at some of those in just a little bit. So, as I said earlier, tonight, we just focus on two things. We look at the effects of massage, and I'm going to share in body rejuvenation techniques. You remember, for those of you who were here last, that we defined the effects of massage as changes that occur in the body, in the mind, and in our emotions as recipients during a massage session. And these changes are the outcomes of the session. For example, muscle relaxation, increased alertness, or reduced anxiety. And we also learned that the effects of massage do not all occur during every session. In fact, the massage techniques used and the qualities of the movement, such as rhythm, pacing, pressure, direction, and duration, they help to determine which effects are likely to occur. So we are looking at a number of effects tonight, but what we want you to understand is that not all of the effects occur in every single session. In fact, the physical, mental, and emotional condition of recipients and the openness to massage might also have impact on which effects occur. So in this presentation, we are going to take a systematic look at the effects of massage in the context of Western anatomy and physiology. That means we will be discussing the physical effects of massage on the body at the tissue level, the organ system level, and the organism level. The body has other levels, but those are the three main levels we are going to be focusing on. And then we are going to be, in terms of the physical effects, And then we are going to look at the psychological effects, and these will be discussed at the level of the whole organism. So just to let you understand where we are at, I know there are some individuals on the platform tonight who do understand this, but for those who may not be familiar with the various parts of the body is made up of different levels. We start right over here at the atomic level, so the tiny minuscule parts that you cannot even see. Then there are molecules, macromolecules, then there are organelles, and different organelles comprise the cell, and then a number of cells make up tissues. So we are going to be focused on tissues tonight. And then there are different organs, but we're not going to be focusing on the organs specifically. We'll focus on the organ systems. So there would be some systems which are comprised of a number of organs. Those systems we are going to be looking at. And then we are going to focus briefly on the whole organism, what massage can do for you as a person. So we are looking at tissue, the tissue level, the organ system level, and the organism level. So those would be our three areas of focus. So we start then by looking at the physical effects of massage at the tissue level. And when we think of tissue, there are different types of tissues in the body. We're not going to do a biology lesson, so you just look at the pictures as they come up so that you can familiarize yourself with what we are speaking about. But we are going to be just speaking to the various effects of massage. And so here on the right, you see various tissues, connective tissue, epithelial, muscle, and nervous tissue. And we are told that massage helps to enhance tissue repair and scar formation. So that if you're wounded, if you get a cut and a bruise, anything like that, or even an incision which is made after surgery, all of those tissues will have to be repaired, and massage to some extent can help to repair those tissues. It also helps to improve the connective tissue health. It improves the pliability of your fascia, and it breaks adhesions and separates tissues. So that these are some of the effects of massage at the tissue level. And then we go now to the organ system level. And because there are a number of different systems, we are going to be taking each one of these in turn. So we start with the integumentary system, which is the skin and all of the various parts of the skin, so that you can look at that while we are going through the effects. So that when one undergoes massage, it helps to stimulate the sensory receptors in the skin, whether they be pain receptors, touch receptors, receptors to cold, and so on. These are stimulated so that they function better. Massage also increases the superficial circulation, that is your blood circulation in the skin. That's referred to as the superficial circulation. Massage helps to remove dead skin. It adds moisture with oil and lotion. And you'll see the massage therapist applying oil sometimes, or sometimes lotion, and that helps add some moisture to the skin. It also increases the secretions of the sebaceous gland, and it facilitates healthy scar formation. So that these are some of the positive effects of massage on the organ system, the integumentary system. And then we go to the skeletal system. And you know, the skeletal system is made up of all of the bones in the body. And so massage helps to promote good joint function. Then it promotes optimal joint flexibility and range of movement. I'm sure you would have heard of individuals who maybe can only raise an arm up to here, cannot carry it up further, but with some massage therapy, they're able to get full range of motion. So that's one of the things that therapy does. It also helps to promote proper skeletal alignment. Sometimes the skeleton, especially the vertebral column, might be misaligned. The hip girdle might be misaligned, and so massage therapy, along with other types of physical therapy, would help to bring those in proper alignment. And then we move to the muscular system. Now, massage helps to drain metabolic wastes into the venous and lymphatic flow. The venous flow would be the veins, so the blood will help to take wastes from the muscles, and the lymphatic flow would be the flow of lymph fluid through the lymph vessels. And we will come to that a little bit later in our presentation tonight. Okay? And massage also promotes specific and general muscle relaxation. You know, when some people become tense, the muscles tend to tighten up. And you hear people who say, oh, the muscles in my shoulders are tight because I'm so stressed. And so massage helps to relax those muscles. Promotes optimal body flexibility so that you're able to move in optimal ways. Relieves myofascial trigger points and also releases myofascial adhesions. Okay, these would be sometimes what we call knots in the muscles, and the massage therapist would have the technique to remove those. I'm sure that Mr. Ferguson may mention that tonight in his demonstration. And then we go to the nervous system. The nervous system is comprised of your brain, the spinal cord. Those two together form your central nervous system. And then all of the other nerves in the body make up the peripheral nervous system. And so massage stimulates the parasympathetic nervous system and brings about what we call the relaxation response. It also helps to reduce pain, so that one example would be neural gating, the neural gating mechanism. Where what you have is a process that suppresses the brain's response to a stimulus, especially if that stimulus is similar to a past stimulus. And so massage helps to correct that. Also helps to sharpen your body awareness so that your senses are sharper, you know, because of the effect of massage on your nervous system. And then we go to the endocrine system. That is the system of various glands in the body, starting from the head right down to your abdominal region. So you have the pineal gland, the pituitary gland, the pancreas, the thymus, the ovaries, the testes in males, ovaries in females, and so on. All of those together make up the endocrine system. And what massage does is it helps the endocrine system to release those endorphins that are necessary to help your system to function effectively, and also to give you that, what we call that feel good feeling. Okay, so but remember, the various glands of the endocrine system have their own job to do in terms of the hormones that they produce. And so again, massage would also help them to function effectively. Then we go to the cardiovascular system. Now, the cardiovascular system would be comprised of your heart, your blood vessels, and sometimes the lungs could be included as part of that, simply because there is what is called a pulmonary circulation, which means a separate circulation of blood to the lungs and back, okay, for the purpose of getting oxygen from the air and releasing carbon dioxide to the air. Okay, so the cardiovascular system is positively affected by massage, because massage helps to increase general and local circulation. So that some people might have sluggish circulation, which could be improved by massage. It also helps to enhance venous return. You know, the veins take blood back to the heart, while the arteries, the red vessels you see in the picture are the arteries, whereas the blue ones are the veins. They take blood back to the heart. Sometimes, if they're not functioning effectively enough, blood would tend to settle in the lower appendages, and so massage helps to enhance the return of that venous blood to your heart. Massage also reduces the blood pressure and your heart rate, and it increases the red blood cells in circulation. So massage does have an important impact on your cardiovascular system. And then on your lymphatic system, remember I mentioned we would mention this a little bit later. The lymphatic system is that whole network of lymph vessels around your body, very quickly, for those who may not understand, sometimes if you have an inflammation, you might get something like a hard lump under your armpits, or maybe in your groin area, and people refer to that as a kernel. It's actually a lymph node. Okay, so that we have a whole circulation of lymph vessels throughout the body, and that helps to boost our immunity by removing toxins from the body. And so massage helps to increase lymph fluid movement so that it doesn't become sluggish, but it moves around the body effectively, efficiently. Massage also improves your immune function, and one of the ways it does that is to reduce stress. So as your stress level is down, then your immunity will go up. So there's that inverse relationship between your immune functioning and your stress level. Reduce your stress, your immune function increases. And then we have the respiratory system. Respiratory system made up, comprised of all of your breathing apparatus. And so when we get massage specifically for that area, it encourages diaphragmatic breathing. Your diaphragm is this muscle here at the base of your thoracic or chest cavity. And so we find a lot of people tend to breathe from up here in the upper chest, but you're supposed to be breathing by using those diaphragmatic muscles, okay? So that massage will help to encourage that diaphragmatic breathing. It helps to relax the muscles of respiration, and it promotes good structural alignment and rib cage expansion. So once your rib cage can expand effectively, you can get an optimal supply of air into your lungs, and the more air you get into your lungs, it would mean that the more oxygen you'll be getting in, and at the same time, you'll be releasing optimum carbon dioxide from the body, because that's a waste and you don't want to keep it in the body. So massage helps to promote all of that. And then we come to the digestive system. Very important. A lot of illnesses start right there in the digestive system. Massage helps to improve digestion with relaxation, and it also facilitates bowel movement. So individuals who are constipated, there are a number of reasons why you could be constipated. In addition to using laxatives and high fiber diets and extra water and so on, you can have a visit to the massage therapist, and they will assist you in facilitating your bowel movements. And then we come to the urinary system. That is the system that gets rid of the urine and takes along with the urine various toxins that the body does not need. And so massage helps to enhance circulation to and from the kidneys. We have the renal arteries taking blood to the kidneys, and the renal veins taking blood away from the kidneys. And so massage helps to enhance that circulation of blood to and from the kidneys. It also increases urinary production and bladder tension, okay? So that you find sometimes there are individuals who, if the bladder does not have enough tension in it, you can have a buildup of urine in there, and then that can lead to certain urinary problems, okay? And so you want your bladder to be functioning effectively, and so massage helps with that as well. And then there is the reproductive system, and we know that there are differences between the reproductive systems of the male and the female. But what is important to note is that massage helps to improve your reproductive system with relaxation, and it also promotes general breast health in the case of females, especially those who are of gestational age, because then you want your breasts to be functioning effectively so that you can feed your baby when it comes. And we move now from the organ system level to the organism level, that is the level of the whole organism. And the first thing we want to look at is growth and development. Believe it or not, massage is important for infants. So it helps to improve growth and development in infants. What we need to understand, however, is that the massage that you do on infants and babies is not the same kind of massage that you do on adults, okay? It's different, but they require some amount of massage to help them with their growth and development. And that continues throughout our own growth and development as we move out of infanthood to childhood, adolescence, and into adulthood. Okay? Massage also helps with pain reduction. So it relieves muscle pain from tension and poor circulation. It deactivates myofascial trigger points. It activates the neural gaining mechanism. I mentioned that a while ago. And it also induces release of endorphins and enkephalins. And so you're able to function so much better. Those endorphins would be the hormones that the body produces to help to relieve pain and improve your mood. I mentioned that a while ago. While the enkephalins, these are opioid peptides that are produced naturally in the body, and they help to regulate pain and other physiological functions. Okay? So that's the pain reduction effect of massage. And then we come to the final one, which is stress reduction. And oh, we live in a world where there is so much stress. And what massage does is it helps to trigger the relaxation response. So again, if you find that you are overly stressful, in addition to nice, good healing music, a visit to the massage therapist is so important because you can greatly benefit from that, help you to relax. Okay, now those were the physical effects. Now we look to the psychological effects, and this is just very brief. The psychological effects of massage, again, at the organism level. So one of the things that massage does is it increases your mental clarity. You're able to think clearer. Your problem-solving ability improves. Your analytic prowess increases. Then it also reduces anxiety. Again, as it removes stress, anxiety is also removed. It facilitates your emotional release. I mean, look at these individuals in this picture. They don't seem to have a worry at all in the world, right? Their emotions are just there on the positive level, okay? And so it promotes that feeling of general well-being that all of us would want to experience. So even if you have a little bit of pain, you don't have to be sad and have a long face and so forth. I mean, you're looking at me now, I'm smiling, right? But I've been in pain for the last 30 years, and you would not know unless I told you. I'm sitting here speaking to you, and I am in pain. And this is what we call chronic pain. So that there is some pain that may not go away, but it can be dealt with. And I have had, quite a number of sessions with my massage therapist, and he does a very good job, and so I appreciate that. And there are other things I do as well to relieve the pain. But what is important is that we get ourselves to the point where our general well-being is just there, okay? So that we don't succumb to stress and anxiety and emotional distress. All right, and that brings us to the end of my part of the presentation. And so the questioning aspect of it will be left for later, because at this time, I would want to turn the platform over to Mr. Aaron Ferguson. And he is a certified massage therapist. He's also a certified reflexologist, and he hails from Prince Edward Island there in Canada. And so he will be coming on to present body rejuvenation techniques, and he will have a very important demonstration for us. So hope you enjoy as we turn now to Mr. Aaron Ferguson. Praise you. I will share again when we come to the question. Or if he has a question slide, he can just share it.
Praise Yahweh. Good afternoon, everybody. Shalom.
Shalom, shalom, good night.
My name is Aaron Ferguson. As Dr. Carty said, I'm the holistic practitioner of Flex Plus Care. And today I have the honor of being able to show some of the techniques that we use and how they actually benefit and how the body benefits from it. So right now, I'll just actually ask for to become the host just to open up my Zoom point as I go. Dr. Carty, can I have the co-host? Can I become a co-host, please?
I am not the host.
Yes.
Maybe if you can just click share and bring it up, it should come up. That's what I
Okay.
would have done. Yes.
Thank you.
You're welcome.
Alrighty. So before I start, I just want to say the importance of massage, the education and the background of massage therapists, because you have massage therapy from someone who's certified and someone who's non-certified. So usual massage therapists they study anatomy and physiology and have over 350 hours of training and are taught over seven professional techniques, and are able to create their own. And they actually know how to keep the client safe as well as themselves when they actually do the do the do the actual therapy. And the thing that's the difference with non-professional masseurs or massage therapists is you have to be careful with just the efficacy isn't as much as with someone who's registered or educated. So I definitely recommend going to a registered massage therapist for that one. Okay. So the first technique I'll be showing, this is my volunteer, is the effleurage. Now the effleurage is a French word meaning to skim or to touch lightly. And this is usually I'm using coconut oil as well. This is usually used as a beginning massage warm-up. It helps to warm the skin up to the touch of the therapist. It helps with the blood circulation, beginning to actually reduce stress. And it's just small, light touches, very gliding technique. And I'm not gonna go very deep into the muscles. I'm just gonna glide over them, and this is gonna help just relax the body and the light fascia layers on the top. And you want to take your time because you want to warm up the client or your person or the person, your family member or the person you're doing it on. You want to warm up their muscles to actually receiving the deeper touch or deeper massage. So this is perfect just for a light de-stress. So I just showed a quick demonstration of how the effleurage massage works. And now we move on to the petrissage, which is actually the deep tissue. And usually a lot of athletes or people who work in construction or very laborious fields or industry areas, a lot of people who have surgery may need this. And I definitely do recommend getting someone who's certified, because what the deep massage is actually using controlled weight with your hand. So I'll ask my volunteer first. Pardon me. Do you have any knots in your back for a perfect demonstration?
Yes, right below my shoulder, like right in the middle.
Okay.
Yeah.
So my client luckily has a perfect problem for us to solve on right now. So what I'm going to do is actually just scan the area with my fingers first, and this can actually be with the effleurage as well. Just working it, but then when you want to get to the petrissage, you actually want to either you can actually use your thumb. Actually, just go starting with in the angle, right angle way and pushing upwards, or you can also use your four fingers. For beginners or people who are just amateurs, I definitely just recommend. And you don't want to just push down on the muscles, but you want to start looking at the roots or near the bone, not on the bone, but close to it. Working those small layers first and working deeper into it. So right now I'm using a bit of pressure but controlled weight. So I'm not using too much to cause pain, but enough that my knuckles can actually pierce right where I want it to, but not damage it, but stimulate it, causing the muscles to open up, causing blood flow to go through this area. And the blood carries oxygen, which feeds the muscles and helps to decrease and other muscular conditions. How's it feeling?
Good, yeah, yeah.
Can I ask, what did you do to get this?
Lifting weights and like jiu-jitsu and stuff like that.
So as I said, this is perfect for athletes. He got this injury doing jiu-jitsu and weightlifting. And with knowledge, you know that this problem might stem even a bit deeper into the back and into his sciatica, into his hips and glutes. Because usually when someone squats, or usually when you're squatting or doing low posture activity, you use a lot of your muscles in your glutes and your thighs. And depending on how well they're connected, you can actually damage yourself, or you can actually do something very, very amazing without hurting yourself. So that's the petrissage. And this is the tapotement, which I consider to be like a double-edged working tool. So the first thing is you can either use chopping like this. I know some people actually do it like this as well. But when you're experienced, you know what you're doing and the situation, you can use the tapotement massage to actually break down different knots. And the weight distribution and the chopping, the timing actually helps to cause the muscles to relax as you go through it. So I'm going to just give you a demonstration. You don't want to use too much pressure to damage the person you're working on. And you want to concentrate also not on just beating one area, but knowing where you're striking and having it on a continuous good rhythm. So not a rhythm that's offbeat, but something that's 1, 2, 1, 2, 1, 2, because that rhythm and that vibration actually helps as well. You feeling?
Right.
Am I putting too much pressure? Perfect. And there. So that's a tapotement technique. And so what it does is you can actually use this and a petrissage, or when you're asking your massage therapist to actually use them maybe in sync, because right after you do it, it really warms up the muscles to even get deeper into it. Do you feel is it deeper than before?
Yeah.
See?
Yeah.
And you want to go much more gentler this time because his body is much more it's very responsive. And lastly, I'll just talk about the effects of your occupation. Occupations such as construction, desk jobs, and manufacturing. A lot of these things that we spend 8 to 12 hours on daily, they cause a syndrome or disorder called repetitive muscular skeletal task disorder or syndrome, where, for instance, if you're someone who does construction, you hammer 8 hours a day, that's going to cause the cartilage to actually burn out if you don't get it massaged, and it can cause blood flow problems because the muscles are tighter than they should be. So that's just an example of a skeletal th- small injury that can actually turn into something bigger. And a lot of these things stem from a trough of muscles. So people who sit down a lot as well usually get affected right here, and it affects the blood flow in their hip area in the lower back, which causes pain and numbness here usually, and you get stiffness and irritation here. So usually people who sit down a lot the pain starts here and starts also from the feet area and travels out. And for people who do construction, it starts usually in, well, whatever you particularly specialize in, it can be the shoulders or the back. So it's really important to actually get a massage frequently and not, well, yeah, frequently to encourage de-stressing and for the body to actually encourage healing and stimulating of homeostasis. Thank you. And that's all I have today. Thank you.
Oh, thank you very much, Mr. Aaron. And I know that Dr. Carty is coming back in to continue to wrap up this wonderful presentation. Dr. Carty?
Yes, thank you very much, Koinaria, and thank you very much, Aaron. Wonderful presentation, and we want to thank your partner who allowed you to operate on him as what we will call the guinea pig for tonight. So thank him for us. And I want us to notice something. During the demonstration, you would notice that Mr. Ferguson was not only speaking to us and explaining to us what he was doing, but he was also having a conversation with the recipient. And that is so important because if the recipient is not communicating, if the massage therapist is not communicating with you, you might be feeling excruciating pain and he may not realize, well, he or she, because there are masseurs who are females, so he or she may not realize. And so it's a good thing to keep that communication line open. So while massage is effective as a touch technique, there is also that communication aspect to it, which is extremely good. So at this time, we would now go into our questioning session, and we will not only open up for questions, but we will also have individuals maybe to make comments if you have maybe a testimony on some positive impact that massage would have had on you and you'd want to share it with others, this is the time to do so. Okay, questions or comments, and we'll turn over to Coinaria. That's Mr. Alex Ferguson, one of our vice presidents of Rafa Shalom Restoration Ministries, and he will lead the discussion from here on. Praise you. Yes.
Thank you very much, Mr. President. And I would like to commend Mr. Aharon Ferguson from FlexCare Plus for a wonderful job and demonstration on the techniques of massage and the benefits. I'm pretty sure that everybody who has witnessed listening to the two parts of this presentation tonight, Dr. Carty's completion of his presentation and Mr. Ferguson's demonstration, you can see the benefits. And I see that Ima Vic already has a hand up, so we're going to go straight to Ima Vic. Go right ahead, Ima Vic.
Yeah, this is something I've wondered about a lot. And I'm a little afraid of deep massage because of this. Is there ever a danger of, let's say, people who tend to have blood clots, of the masseur breaking up a blood clot from a deep massage and like maybe pieces like traveling to dangerous parts of your body?
Okay, I think maybe we could have Aaron Ferguson respond to that as the professional masseur. Yes.
Yes. Ima.
Vic.
So when it comes to especially the blood clots, I've had a lot of clients who had blood clots in their legs and whatnot. And with those, I actually tend not to actually do any type of massage on that area because you can cause pain and it can cause even the situation to worsen. But what I do recommend would be two things. Reflexology, because reflexology would help it would help actually open up the blood vessels to actually carry it out, or acupressure. Someone who knows the meridians of the body, because I actually do it. I actually work with it myself. I had a client who had, I think, blood clots between in the corner and the crease of her legs. And what I did was acupressure, and it helped, and I did it around the area. And that helped that helped me to actually weaken the blood clot so that I can actually do the deep massage to get it to pass through. But it takes almost a two-step approach, if that answers the question.
Okay, thanks. Yes, thank you.
Okay, we have a question coming in from Kimoy, and the question is, wouldn't acupuncture also work for the blood clot? Acupuncture is the traditional Chinese method using needles to in the meridian areas, like Mr. Ferguson mentioned earlier. Now, would you like to speak toward that, Aaron? Mr. Ferguson, about acupuncture?
Yes. I am not a certified acupuncturist, so I cannot speak on that. Acupuncture and acupressure is two different things. Second of all, acupuncture is dealing with needles. It's to stimulate different, to cause different healing responses in the body, while acupressure is using touch. So you're using your finger, you're using your touch to actually do it instead. But that can actually, acupuncture can actually help because it will actually open up the different meridians that actually help break down the blood clot. But I don't know much on acupuncture compared to acupressure, where I know it's more safer because I use my hands. I don't use needles. I don't use any invasive techniques. So I use my hands, and if you have someone who is skilled and experienced enough in acupressure, they can, especially maybe in 1 or 2 sessions, actually completely have that changed and have it broken down semi to semi base. But yeah, acupressure and I say acupressure does work, and acupuncture would work as well because it's the relative of that branch of relative of
Yes,
that field.
right. Thank you so much for that response. Dr. Carty, you were about to say something?
No.
Okay. Yes, and Mr. Ferguson said, acupressure and acupuncture, you could say sisters. One is invasive, the other is using pressure. And traditional Chinese medicine is very effective. So if you have someone trained in those areas, as was stressed on the program this evening, I'm pretty sure that the results can be obtained. Okay, do we have any other questions? I heard you mention, Mr. Ferguson, about reflexology for assisting in opening up the blood vessels, and when it comes to blood clots, allowing the blood vessel to open up and allowing for movement of that clot from that area. You want to say something a little bit more on that, just for the benefits? Because reflexology, we know, is very, very effective. It's very old and it's very effective. Your mic is off.
Just like a massage therapy, for instance, Swedish therapy comes from some I forget the therapist's name, but it was developed in Sweden. Reflexology was mostly developed in Africa, India, and China. So you can see where the differences that come where they come from, the differences. But with reflexology can actually stimulate especially if you know what you're doing. You can, because the reflex points in the feet, they actually travel straight up through the body. And I had a client with visceroid vein, I think they call it visceroid veins.
Miracles.
Why keep you saying visceroid? Varicose. I don't know why. I don't know why I had that in my brain. Varicose veins.
Very close, right.
And she said that she couldn't actually put on her jean pants because the rubbing of them would cause so much pain and irritation. So what I did was the reflexology first on her feet, and that actually opened up, especially the lymph nodes and lymph vessels, to cause especially fluid to travel. So after I accomplished that and opening the blood circulation to promote blood circulation, I went further, and a certified, maybe someone who's certified in acupressure could do this, but I with reflexology, especially advanced, when you're getting into the advanced stages, you can actually use the reflex points that go down the feet and travel up straight down to that area. And you can actually hit a point in that area, in that leg, hit a point in that foot, and in that same foot. And you can actually stretch on one maneuver can actually cause it to completely break apart. Because I actually did it in one session with her. So it's actually using, I guess, advanced reflexology, which isn't really spoken or capitalized upon today. They usually just use the base reflexology, but just how massage therapy has been building upon over the years, so has the other therapies as well.
Yes, and
Yes. And okay, I was just going to add, when you speak about the foot, we're referring to the sole of the foot, because it is the sole of the foot that is a map of the entire body. So that, under the toes, you would have the head, and, the shoulders would be towards the side, and so on and so forth. You'll come to the intestines and the various organs, and it's all mapped on the sole of the foot. And that is why you quite rightly said, you touch a certain point and it will impact a certain area of the body.
Well, can I speak?
yes, go right ahead.
Go right ahead.
As what Dr. Carty was saying, it's the palm. If you can see my diagram, it's the palm. It's the sole of the feet. It's
Yes.
the dorsal view on the top. It's the sides of the feet as well. So
Yeah.
reflexology covers all those points. And when a reflexologist is learned to an extent, one can actually tell where each point is in the feet that connect in the body.
Yes.
So let's say you have gas, right? I would hit something, hit a point in your colon area, your colon or your small intestine, and then I would actually do a corresponding point, con- contra- another point in the stomach area, and I would stretch that area. I would stretch those 2 points, and that would release gas, bladder issues, if
Right.
in the kidneys and
Mhm.
the ureters. But yes,
Very
and
nice.
it also works for the hands as well.
Thank you for that. I'll share this. We did have a session on reflexology, a 5 session on reflexology that I did, and we had our demonstration too on our client, and everything that you say is actually verifying the presentation. Also, the importance of the blood vessels and the lymph vessels and being stimulated, whether through massage or a different modality similar to massage, is very, very important, especially after surgery, because normally after surgery, whenever you've been cut, you'd find the accumulation of lymphatic fluids creating swelling called edema. And that could happen around the waist. It could happen in various parts of the body. And especially at the bottom of the feet. Someone is just putting in, if I may add, there are yoga, Qigong, and Tai Chi. Yes, all of those exercises help with increasing the blood flow. And because the lymphatic vessels lie so close to the blood vessels, it's hard not to affect one without affecting the other. So anything that would benefit one will definitely benefit the other. And as Dr. Carty pointed out, the lymphatic system is very important since it carries the waste away from the body and also helps with the white blood cells and circulating. So you definitely want to make sure that there's a free flow.
Yes. And we do have another question on the board from Rubina Wilkinson. Would you recommend massage to someone who has a cold or flu? Aaron?
Mike?
Yes, I would. Definitely not a deep tissue. Definitely not a deep tissue, because you would have that person would be in pain because of the sensitivity during the illness. But if you have especially a medicinal ointment, for instance, when I was younger, in my house, my father had what was called, I think we call it Chinese oil, it's called Huan Long oil.
One Logan.
And if you have a medicinal oil such as that, you can massage, especially the soles of the feet, because the skin absorbs the fluid that you would apply to your soles of your feet. The pores are so wide that they actually would absorb it. So putting it on the soles, massaging on the soles, especially massaging the toes, that would help open up and stimulate the nasal reflexes so that person can breathe. And the ointment will actually help further. And then if you want to massage that chest area with that, maybe Buckley's rub or whatnot, massage it to loosen up the muscles and the fascia in the chest. But the ointment will also stimulate and help break up the phlegm. If the muscles are breaking down, it'll help them cough it up even more easier. And then if you want to be doing a deluxe, slap someone, put some on the head and on the temples, not near the eyes, but a little amount on temples, and that alone can keep that person warm and helps with actually breaking the mucus, helping the body to say, I need to get the mucus out. I hope that answers your question.
Good. Okay, that's that question. Okay. While we're on this topic, does anybody else have a question? Robina just said, thank you. Robina Wilkinson just said, thank you. Sorry, that answered the question. Another question from my good friend CJ, my brother. What would you say is the ideal age to start getting massages? Dr. Carty mentioned that earlier, I got to say. from baby. But there are different types of massages for that, so I'll let you go ahead. You are Dr. Carty, either.
Well,
Yes, I will leave it to Aaron because he's the massage therapist.
I have worked with younger kids. I've worked with adults, seniors, middle-aged adults, and I deal with teenagers and younger kids. And the difference between the difference between a young child and an older person is the younger child's body is developing. So it's growing and it's building up itself. And a person who's older, their body is mostly developed. So you actually have to maintain that. But you have a baby or someone who's young, massage is so good for their body. It helps to stimulate, it helps get the muscles actually stimulated and actually help with blood flow, flexibility. Definitely flexibility, just getting, because you know how babies move, but just actually having someone, because when you do a massage for a child or toddler, you're practically using these. And you're actually just soft touches and especially the effleurage is really good and stimulating, especially the nervous system, getting the nervous system really active and all the different systems really active. It's a good Kickstarter. And when they're in their teenage years, in the athletic years, or when they're in their puberty, I would definitely recommend it. I know a lot of parents don't do it, but that is also the time when you should, because that's another booster when your kid is
Yeah.
growing and transforming. So that alone would help with, kids who are overweight as well. It can actually kickstart stimulating the thyroid gland, or your kids who are really active. It can help lower their blood pressure, actually get them calm. If your kid is really active and let's say a basketball player, football player, a massage actually will, because their body will repair itself. But how it repairs itself is the matter of concern. And a massage will actually help the body, especially a young person's body, repair itself faster and in the correct way.
Yes.
Um, and I guess when you're getting into your work years, you want to keep that going because at 8 to 12, I don't need to tell anybody about it. They should know.
Okay. Well, thanks for the response. Dr. Carty, you wanted to say something on that? Because you covered it earlier, and Aaron just substantiated, so both of you
Yes.
working together nicely.
And one thing I would say, maybe folks might be wondering why I would defer to Aaron to answer the questions. Because even though I would have studied massage therapy during my studies in naturopathic medicine, I have not made a point to practice massage because my hands are not very strong. In fact, both of my thumbs were injured very young in basketball. And even as I did this just now, the pain sets in. Those injuries never seem to heal. And that's one of the ills of playing basketball. And, the pains in the fingers. And you use your hands a lot for massage. So I've stayed away from that. I can speak to it, yes, but, speaking to it mainly from a theoretical standpoint rather than from a practical standpoint. And so that is why we are happy to have our massage therapist here. And by the way, I should share a little secret with you because you would have noticed the names of those two gentlemen. The surname is the same because Mr. Alex Ferguson, whom we see online as Cohen Area, who is coordinating, he's actually the father of Aaron. Cohen is in Bahamas, that's where his home is, but Aaron lives in Prince Edward Island, Canada, and he practices there. So, like father, like son to a certain extent, or as we said, the apple doesn't fall far from the tree. So, very happy that Aaron had followed that path, and I'm sure that there are lots and lots of individuals in Canada who are benefiting from your work. So, thank you very much, Prezia, for your
Great.
Thank you very much, Dr. Carty. Really honored to be here.
questions, comments.
Also, I want to say Speaking on jam fingers, because that's what I used to call them back in the Bahamas.
Yes.
I used to play basketball a lot, so I can tell you over how much times I catch a ball wrong, and I've jammed every finger, multiple times, re-jam a finger playing basketball too. So even
Mm.
those things can, and getting injuries when you're a kid and not telling your parents.
Yes.
I think parents should actually talk to their kids, especially if they had a rough day. Did you hurt yourself? And really talk to them because you won't know
Mhm.
how bad that kid is actually. He won't know. He won't feel it until the bones or the cartilage reform in such a way that it might have to be broken or put into a way of restructured.
Yes.
So if your kid goes basketball, ask him if he could jam any fingers. Make sure that he put them on ice, get a massage, make sure get the fingers working again because when he goes into other, or when he or she goes into other fields of life that requires neuromuscular connective activity, so something that's really technical, you don't want their hands to be a liability.
Right.
I'm just saying, so I encourage parents to actually talk to their kids, know what's happening with your child's physical body.
Yeah.
Good advice. Very good advice. I would like to say though, as a reflexologist, you could attest your hands, fingers, and hand strength increases dramatically over the years, which does allow you sometimes to be very helpful to persons, especially stroke individuals who might have an affected limb. Um, the amount of pressure needed, you could actually apply sustained pressure for the benefit of the individual. So in doing it, I know that the hands become so much stronger. And what you notice too, I don't know if it's not happening with you yet, Aaron, but your fingernails seem to grow so rapidly. You have to clip them so frequently. It's because I guess it's the blood flow and everything, the exercise, but it makes your fingers stronger. Your grip, the grasp, under pressure.
Um, I can actually speak on that, if I may. Um, I was at a diversity fair and I had my own booth. It was a big fair, music playing, and I was the only massage therapist at the fair. So I have my own little booth, and I had this lady come to me, and she was I think she's from Nova Scotia, and she asked me to work on her hands, and her hands looked like they did some carpentry. And I was like, "What did you do with your hands?" Because what I could feel really set in was cartilage damage, tendon, taut tendons, and the blood circulation was poor. But she said that she was a massage therapist, and when she works on men who are like 400 pounds, she said the amount of strength and stress she puts on her hands actually damages her.
Oh, yeah.
So it's really important, especially maybe if you're aspiring to be a therapist, or even if you're not, hand strength. Your fingers, your phalanges, and your metatarsals, really important to have those individual digits strong. And the lymph vessels go through all of them. So
Yeah.
when your fingers are fat, your blood is being clogged. The flow of lymph is not as effective, and then it also causes buildup of blood, maybe problem of blood flow in your forearms and whatnot. So that leads to a whole tree of branches of problem or issues. So so yeah, I think strengthening our fingers was reflexology does do that. But I think since massage does so much different techniques, they don't have time to concentrate on just one constant flow.
Mhm. Okay. Well, thank you very much for that. And do we have any more questions or comments or testimonials concerning massage somebody might have, or more questions concerning the benefits or application of massage? Okay, question from CJ. What body part would you say patients often request massage for the most?
Depending on their occupation.
All right.
So can I ask CJ, if I may, what occupation are you in? Because depending on, let's say,
He's a computer repair person. He's a computer technician.
computer technicians, I've had a few. They sit down a lot, posture is bad, so then they have sometimes stress in their neck that goes straight down to the lumbar area, the hips area, and then they work with their hands, so it goes, and if your hands are not de-stressed after doing a lot of technical things, that can build up a lot of stress straight to the forearms, elbows, and shoulders. So it's depending on the occupation. I think one of the most is the glutes. I've had so many people have come back with lift injuries, but they're saying it's in the back and it's in the back. But I asked, how did you lift? What were you lifting? And they're saying they're lifting a crate and they did it like this. And right when they show me the posture, I can immediately see where they went wrong. So I'd say a lot of mine is the hips, the glutes, and the lower back. I have a farmer who is 400 pounds. He is 6'5". And the last time he came in, he had a horse that kicked him in his abdomen. So he said and it broke 2 ribs, but it didn't detach him. And he came to me like right when I was closing, and he said, I need to work tomorrow. And he can't lift his shoulder. So I use massage, and I had to deal with a load of problems because it was like 4 hour session. But I had to deal with but by the time I got to the shoulder, I had to deal with all the forming issues he had that accumulated, and then the shoulder issue. So it depends on your occupation, and if you get an injury on top of it, it can lead to bigger problems.
Thank you for that. Okay, platform, we're coming up on the time limit for questions and comments. Does anybody have a comment or question that they would like to present before we bring our tonight's presentation to an end? Okay, yes, Imavik.
Yeah, this is just I'm just curious. This is an old-fashioned remedy because Mr. Ferguson is into massage therapy. Sorry, Cohen. And it way back in the day, I know that people, along with massage therapy, people used overproof alcohol with the massage to heal an injured muscle or joint, and it worked extremely well. I just want to know whether this is still practiced.
It is. The funny thing why I can say it is because I had a friend who was from Vietnam. He went to Vietnam and he came back and he said he brought me a gift, and it was an ointment made of different spices and herbs soaked in ethanol and alcohol. And when I rubbed it on my skin, I immediately felt the effect of cooling and relaxation.
Yes.
And I don't know, still don't know what in it. Trying to analyze it, but the alcohol does have an effect, just as well as certain oils. So, but both of them have different effects. So understanding what the effect of oil would have and the effect of alcohol would have, and why would you use it and when to use it would be the wise things as well to consider. But we still do use it.
Okay, thank you. Thanks.
Yeah, there are quite a few remedies using alcohol for pain, and usually it's mixed, and alcohol acts like a carrier. For instance, there's a herb in Jamaica called the guinea hen weed. The guinea hen weed, once soaked in green alcohol, is so effective in relieving pain. And the same thing with, excuse me, pear pits, the seed of the avocado pear, crushing it or dicing it up, letting it soak in the alcohol. The two components make for a very effective topical painkiller. So those are things that that carried out uses with the alcohol, and the alcohol enhances the effect. So that's good. So I do hope everybody had a very informative night this evening, and recognize the benefits of massage. We know that according to your occupation, it might be very helpful for maintenance to get regular massages, and to seek out certified therapists to assist in it. It's better always to prevent something from happening rather than treat it after it's happened. So I want to thank Dr. Carty for a very wonderful presentation, and also for inviting Mr. Aaron Ferguson from FlexCare for his presentation, and wonderful job. Mr. Ferguson, I can call you Mr. Ferguson, right? That's okay? Okay, yes, Mr. Ferguson, I wanted, on behalf of Rapha Shalom Restoration Ministries International, his vice president and the Health Corner team, we want to say thank you for what you did this evening. And I'm pretty sure that Dr. Carty would want to have something to say to you before we close. So, Dr. Carty.
Yes, I just want to thank Aaron for assisting us tonight and sharing of his expertise, and to thank all of you who joined us tonight. I am very happy to see you, and I want to ask you for one small favor. We do present these health topics, and we simply give you what we think you need. But there might be individuals on the platform who would have specific needs for particular bits and pieces of information as regards to your health. So I would ask you to take down my number, and the cell number is 869-665-8968, as you see down in the information section, or the email address lamarienhc@gmail.com, and you send a tip. Just say, okay, I would like you to do a presentation on this topic or that, and we will certainly appreciate your requests, and we will work on those presentations for you. So it's not just about us giving you what we think you need, but you assisting us to give you what you need by telling us, what areas you would want us to present on, and we will work on those for you. Okay, so we will see you again in the next 2 weeks, Yah willing, because it is every other Tuesday night that we present our Health Corner, and we will have another exciting session for you, and informative session. Okay, so once again, remember, just send your suggestions as to what topics you would want us to work with, and we will organize those for you, both Cohen area, Mr. Ferguson, along with Juliet Allen, our other vice president, and she's also in Canada. And I think she might be working tonight.
Yes.
She's a nurse and she's on shift. So that's why you may not see her on the platform sometimes, because of her work. So thank you very much. And I now turn back to Mr. Ferguson, Cohen area, for the closing.
Thank you very much, Dr. Carty. And I am glad that you mentioned Nurse Juliet, because some persons might not have seen her on the platform for a while, but her heart is still very much here and is still very much a part of this team. So once again, we want to thank everybody on the platform for being here tonight. And we hope to see you again in 2 weeks. And please invite somebody who has an issue, invite somebody who might have a question. Dr. Carty, I think we might in the future give a 5 minutes to a general question. Not necessarily on the topic that we are presenting, but yes, just because people might come and they might have a question that that is not on the topic, but we are available right there and then and can help out. And that's what the ministry is all about, helping persons to find natural ways for restoration, that which the Creator has placed here for us to use and utilize.
Yes.
Yes, and I see Eleanor, nice to see Eleanor, saying thanks for the information tonight. Glad that you were here. And for each person on the platform, you are all unique and very special. Thank you for being here this evening. We look forward to seeing you in 2 weeks. As Dr. Carty said, we will be presenting another informative and helpful platform. So we open this platform with recognition to the Most High. We will close the platform with the same. And I hope he doesn't mind me calling on him again. And that is my friend CJ. Good night, Michelle. Nice to see you on also. These are some. Okay, can massage help with aristus, atristus? Dr. Carter, you saw that atristus? You familiar with that term? Or
No.
autism?
Wait, my chat is down.
Okay.
Is it, was it made, I don't know.
It was it was spelled artistic, but it might be a reference to autism. I don't know. And that's just
arthritis. I think the person
arthritis. Okay. Okay, yes,
Yeah,
arthritis.
yeah.
Sorry, Doreen.
Yeah, the
Yes.
answer is yes. The answer is yes.
Yes.
Because remember we spoke about enhancing joint movement, and a lot of times people who have arthritis think that they're not supposed to move around, they're supposed to be resting. But in truth and in fact, you have to get those
Yes.
joints moving.
Yep.
Because it helps to stimulate the synovial fluid in the joint, it helps to stimulate the rebuilding of cartilage, and massage does. And that, remember we spoke when I mentioned it when we spoke about the skeletal system. So that is so important. Anything to add to that, Aaron?
Yeah, yes, sir. So, with arthritis, what all Dr. Carty said was true and would actually definitely help. But when I'm dealing with arthritis, depending on the level of it as well, if it's on the beginning stage,
Yeah.
deep massage can help increase, as he said, the synovial fluid and the flexibility of the muscles and the tendons. But I believe that as you get into people who have really severe cases, I would refer to acupressure, something else, as an acupressure, physiotherapy, or reflexology, because especially what I do as a certified reflexologist, I can speak on it. It definitely breaks down the lactic acid and the muscle, the stiffness of the muscles, and it actually stimulates the nervous system and the tendons. Um, Stimulates the nervous tendons, and it covers all the aspect of if you have arthritis in your hands, or it covers all the aspects. And if you have it in your feet, it covers all the aspects. So it covers all the sides, and it increases my flexibility after the session is finished. Um, but if you have, especially if you have it in the knees or so, massage is good. But I also encourage physiotherapy because Dr. Carty said you have to keep it you have to keep on moving and actually get the body to actually start to heal itself to homeostasis. And you can't do that staying still.
Okay, there's one other question.
Yes.
That Bridget is asking, what are the benefits of mechanical massage? I think she's asking us to compare.
Yes, versus
with mechanical with manual. Okay, because there are tools, equipments that one can use in addition to the hands. So, could speak to that, Aaron?
I can, because in Canada, there's only 101 massage tools that's come out every other day. Some of them are really good, I won't lie. Some of them are the bomb. But you can buy one, you can actually buy it, but because you don't know what your body might need. So you can have a tool and not know how to use it correctly or apply it correctly. And that's why, and it does have, you have some machines that do high vibration, and have different prong settings to actually help stimulate the muscles. But again, because a lot of people lack the knowledge, they can use that and be doing something that's either it feels good but totally ineffective for the situation they're dealing with. or they can actually be hurting themselves because it could be on a very high level, or they could put it on they can use it for an extensive amount of time on one area, cause damage. So that's the difference between someone who has, I guess, mechanical massage, because there's no off button, there's no sensor, and it isn't a human to actually know how the body fluctuates. So someone who's doing the manual is on hand to hand. So I mean, sorry, hand to body. So it's more in person. You get the healing from that person who is the healer, and you get more care and more effective work because they actually studied and they know what they're doing. Yeah.
Yes, and I can attest to that, Aaron, because my therapist uses both his hands and the machines. Some of those would be like the vibrator. And what I find is that when he uses his hands, I experience less pain than when he uses the machines. Because I think what would happen is that you're not quite certain how much force is being put on the muscles or on the tissues. And that's why it's important, to communicate with the recipient so that they could say, well, okay, this is too painful, or it's just the right amount of pain, as the case might be. Because massage therapy should not be so painful that it is uncomfortable. That is counterproductive. Okay, there should be a small degree of pain, yes, because you're manipulating the muscles and the tissues, but not so much pain that it is uncomfortable.
I'd like to add.
May I just add one other thing? Because individuals can self-massage in the sense that there are things that you can use. For example, we have massage seats that you can put in your chair. In fact, there are actually massage chairs. There are some recliners that come with the equipment in them so that you can get, almost a full body massage from your neck down even to your thighs. And then there are also like compression massage things that you can put on your thighs, on your legs, and so forth. And it's important that individuals who purchase those follow directions carefully, because you may not be a professional therapist, but you have access to it, you buy it, you want to use it as safely as possible. Okay, so just wanted to throw that out because they are available and individuals would purchase them. So just be careful when you're doing self-massage. Yes.
Yes.
I'd also like to add on that is you have a massage chair. The reason I guess they were actually brought out is actually for people who aren't really in the injury, who actually want to prevent the injury. People who have the injury, it can be good, but because the machine doesn't have senses and isn't a living person to actually analyze your situation, you could be doing more harm than good. So
Yes.
if you're injured, you go to someone. I recommend going to certified someone. But if you're trying to prevent it, maintain your relaxation, you can get a massage chair. That's definitely good for someone who's trying to maintain. But if you're already in the problem, you need someone certified to help you get out the problem.
Yes. Very good. Thank you. And what I was going to add to that is right along the same lines. Bridget Henry asked such a good question. Mechanical massage versus manual. The individual touch on the flesh allows for a better understanding of what's going on beneath the surface of the skin,
Yes.
whereas a mechanical instrument cannot do that. And Dr. Carty's massage therapist, I would think that he would actually use his hands to find spots and then just use the machine just to make application after that. But the touch to a sensitive person, a sensitive therapist, he can touch the skin and know what's going on and how to apply it. So that's very, very effective. So thanks very much, Ms. Henry, for that last question. And once again, I want to thank everybody for being here this evening. And I do hope that Brother CJ is still on the platform, because I would like to invite him to close us in prayer. And I see he is. Thanks for staying, CJ. Let's bow our heads, please.
Indeed. Father Yahweh, we come before you this evening, just thanking you for another day on this planet. Father, we thank you for continuing to use Dr. Carty, Cohen Ferguson, and Nurse Allen to help us learn and grow in the truths of health, Father. And we pray that you will continue to increase them financially, increase them spiritually, increase them in their wisdom and their knowledge, that they continue to lead us out of the darkness and lies that we have been taught about health and into the truth, that way so we can be healthy and effective doers of your word, Father. For we know that being trapped in sickness and pain limits our ability to help others and to ultimately be the light that you've called us to be, Father. So we thank you for all that you've done for us and all that you continue to do for us, and that you continue to allow this platform to enrich and enlighten us all. And we thank you and your Son, Yeshua the Messiah, for all that you've done for us and will continue to do. In the mighty name of Yahweh, our Creator. Amen.
Amen. Amen. Once again, thank you, everyone. And on behalf of RSRMI and the Health Corner team, have a wonderful evening. Stay healthy. May you prosper and be in good health. Until next 2 weeks, have a good evening. Shalom.
Shalom, shalom. Good night, everybody.
Shalom. Good night.